Magandang araw po sa ating lahat! Nagbabalik po tayo sa ating rationalization and the common questions na possible na lalabas sa board exam, at ang ating pag-usapan ngayon is all about care of clients with GI disorders. So wag na nating patagalin, let's start. Number 1. Which of the following has been identified as a potential risk factor for the development of colon cancer? Potential risk factor for the development of colon cancer. A. Chronic constipation. Letter B. Long-term use of laxatives. Letter C. History of smoking. And letter D. History of inflammatory bowel disease. Ang sagot po natin dito is letter D. A common risk factor for the development of colon cancer is inflammatory bowel disorder or disease like Crohn's disease and ulcerative colitis. Again, a common risk factor for the development of colon cancer is inflammatory bowel disorder like Crohn's disease or ulcerative colitis. Dito, try to imagine yung Crohn's disease. May persistent or chronic inflammation which leads to repeated cycles of injury and repair. Okay? At sa process na ito, it can cause genetic mutations and epigenetic changes na pwedeng mag-contribute sa cancer development. Okay, so our answer here is letter D, history of inflammatory bowel disease. Number 2. The client with colon cancer has an abdominoperineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-op period? Again, the client with colon cancer has an abdominoperineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-op period? A. Maintain the client in semi-Fowler's position. Letter B. Assist the client with warm sitz bath. Letter C. Administer 30 ml of milk of magnesia to stimulate colostomy activity. And letter D. Remove the ostomy pouch as needed so the stomach can be assessed. First of all, abdominoperineal resection, ito yung procedure na tatanggalin nila yung anus, rectum, and part of the colon. The client who had undergone abdominoperineal resection will have warm sitz bath after 24 hours post-op to improve circulation to the perineal area, thereby relieving pain and promoting healing. Therefore, ang sagot po natin dito is letter B. Assist the client with warm sitz bath. Okay? Number 3. The nurse evaluates the client's stoma during the initial postoperative period. Which of the following observations should be reported immediately to the physician? Should be reported immediately to the physician. A. The stoma is slightly edematous. Letter B. The stoma is dark red to purple. Letter C. The stoma oozes a small amount of blood. And letter D. The stoma does not expel stool. Ang sagot po natin dito is letter B. Dark red to purple discoloration of the stoma indicates impaired circulation and necrosis. This requires immediate reporting to the physician. Ano ba yung normal color ng stoma? Ang normal color po ng stoma is pink to red. Okay? Pink to red. This indicates na merong magandang blood flow and oxygenation yung stoma. Basta ang sagot natin dito that needs to be reported immediately to the physician is letter B, dark red to purple discoloration of the stoma because this indicates impaired circulation and necrosis. Letter B po, kailangang i-report immediately to the physician. Number 4. While changing the client's colostomy bag and dressing, the nurse assesses that the client is ready to participate on her care by noticing which of the following. Ang sagot po natin dito is letter B. The client asked on the supplies used during the dressing change. Kapag ang patient ay nagpapakita na siya ng interest sa colostomy and colostomy care, this indicates readiness to learn and participate in his care. Again, our answer here is letter B. The client asked on the supplies used during the dressing change. Okay? Number 5. When planning diet teaching for a client with a colostomy, the nurse would develop a plan that emphasizes which of the following dietary instructions. A. Foods containing roughage should not be eaten. Letter B. Liquid is best limited to prevent diarrhea. Letter C. Clients should experiment to find a diet that is best for them. And letter D. A high-fiber diet will produce a regular passage of stool. Ang sagot po natin dito is letter C. Clients should experiment to find a diet that is best for them. Okay? Ang food tolerance po ay iba-iba sa bawat individual. What works for one person may not work for another. So the client can experiment to find the diet that is best for him. Yung letter A, mali po because foods containing roughage such as fruits, vegetables, and whole grains are essential for a balanced diet at nakakatulong pa nga ito to regulate bowel movement. Okay? So roughage should be encouraged and should not be avoided. Yung letter B naman, mali po because adequate fluid intake is essential for preventing dehydration and constipation. So clients should aim to drink 8 to 10 glasses of fluid per day. Yung letter D naman, mali din po because a high fiber diet may not suitable for everyone with a colostomy. Because yung mga ibang high fiber foods can be difficult to digest and may cause blockages or other complications. So ang recommended po dito is balanced diet that includes variety of foods rather than a high fiber diet specifically. Okay? Balanced diet po. Moreover, gas-forming and foul odor foods are particularly avoided kasi babaho siya. Okay? Basta ang sagot natin dito is letter C. Clients should experiment to find the diet that is best for them. Client with a colostomy. Okay? Number 6. The nurse teaches the client who has had rectal surgery the proper timing of sitz baths. The nurse knows that the client has understood the teaching when the client states that it is most important to take a sitz bath. Ang sagot po natin dito is letter C, after a bowel movement. The best time to perform warm sitz bath after rectal surgery is after a bowel movement. This ensures adequate cleansing of the area and prevents infection. Diba? Basta ang sagot natin dito for the proper timing for sitz bath is after a bowel movement for a patient who had rectal surgery. Number 7. Which goal for the client's care should take priority during the first day of hospitalization for an exacerbation of ulcerative colitis? A. Promoting self-care and independence. Letter B. Managing diarrhea. Letter C. Maintaining adequate nutrition. And letter D. Promoting rest and comfort. Ang sagot po natin dito is letter B. The primary problem of the client with ulcerative colitis is severe diarrhea. Therefore, managing diarrhea should take priority in his care to prevent dehydration, electrolyte imbalances, and further complications. Ang sagot natin dito is letter B, managing diarrhea. Number 8. A client who has ulcerative colitis says to the nurse, "I can't take this anymore. I'm constantly in pain and I can't leave my room because I need to stay by the toilet. I don't know how to deal with this." Based on these comments, an appropriate nursing diagnosis for a client would be A. Impaired physical mobility related to fatigue. Letter B. Disturbed thought processes related to chronic fatigue. Letter C. Social isolation related to chronic fatigue. And letter D. Ineffective coping related to chronic abdominal pain. Ang sagot po natin dito is letter D. Ineffective coping related to chronic abdominal pain. Ineffective coping is evidenced by the client's inability to deal successfully with his present situation. And the client feels that he is no longer in control of himself and his situation. Okay? Number 9. A client who has ulcerative colitis has persistent diarrhea. He is thin and has lost 12 pounds since the exacerbation of his ulcerative colitis. The nurse should anticipate that the physician will order which of the following treatment approaches to help the client meet his nutritional needs. A. Initiate continuous enteral feedings. Letter B. Encourage a high-calorie, high-protein diet. And letter C. Implement total parenteral nutrition. And letter D. Provide 6 small meals a day. Ang sagot po natin dito is letter C. Implement total parenteral nutrition. Severe malnutrition as evidenced by excessive weight loss in a client with ulcerative colitis requires administration of TPN as prescribed. Kasi nga, sa ulcerative colitis, there is damage and inflammation to the intestinal lining. Therefore, there is inability to absorb nutrients, so hindi sapat kung oral feedings alone. Okay? Hindi kakayanin kung enteral feedings lang. So, TPN ang sagot natin because it provides nutrients including proteins, carbohydrates, fats, vitamins, and minerals directly into the bloodstream, bypassing the digestive system para hindi na rin mahirapan pa yung inflamed intestine ng patient. Okay, again, common board exam question, our answer here is letter C. Implement total parenteral nutrition. Okay, number 10. A client with Crohn's disease experiences rectal bleeding along with 15 to 20 watery stools per day. Which of the following signs would be indicative of dehydration? Letter A, sunken eyeballs. Letter B, decreased pulse rate. Letter C, moist skin. And letter D, pitting edema. Ang sagot po natin dito, obviously, is letter A. Sunken eyeball is an indicative of dehydration. Mali po ang letter B, letter C, and letter D kasi nga manifestations of dehydration are increased pulse rate, dry and warm skin, oliguria, dark concentrated urine, increased respiratory rate, fever, increased specific gravity of urine, and low BP. Yan po yung mga manifestations. ng dehydration. Okay? So, number 11. Which of the following would be a priority focus of care of the client experiencing an exacerbation of Crohn's disease? A. Encouraging regular ambulation. B. Promoting bowel rest. Letter C. Maintaining current weight. And letter D. Decreasing episodes of rectal bleeding. Ang sagot po natin dito is letter B. In Crohn's disease, there is hyperactive bowel causing diarrhea. So, promoting bowel rest will relieve diarrhea and abdominal pain. Again, in Crohn's disease, there is hyperactive bowel causing diarrhea. So, promoting bowel rest will relieve diarrhea and abdominal pain. Okay? Sagot natin dito is letter B. Number 12. The physician orders intestinal decompression with a Cantor tube for the client. The primary purpose of nasoenteric tubes such as a Cantor tube is letter A. To remove fluids and gas from intestines. Letter B. To prevent fluid accumulation in the stomach. Letter C. To break up the obstruction. And letter D. To provide an alternative route for drug administration. Ang sagot po natin dito is letter A. The primary purpose of nasoenteric tubes like Cantor tube is for the compression or drainage of fluids and gas from intestines. Again, the primary purpose of nasoenteric tubes like Cantor tube is for the compression or drainage of fluids and gas from intestines. Okay, wag po natin kalilimutan. Next question. Number 13, which of the following nursing diagnosis would be most appropriate for a client with an intestinal obstruction? Again, which of the following nursing diagnosis would be most appropriate for a client with an intestinal obstruction? Letter A, impaired swallowing related to NPO status. Letter B, urinary retention related to deficient fluid volume. Letter C, deficient fluid volume related to nausea and vomiting. And letter D, chronic pain related to abdominal distension. Ang sagot po natin dito is letter C. Deficient fluid volume related to nausea and vomiting. Okay? Intestinal obstruction causes reverse peristalsis. Intestinal obstruction causes reverse peristalsis. And it is characterized by severe nausea and vomiting. Okay? This results to severe fluid electrolyte imbalances, of course. Again, intestinal obstruction causes reverse peristalsis. It is characterized by severe nausea and vomiting. Okay, ang sagot natin dito is letter C. Deficient fluid volume related to nausea and vomiting. Number 14. A client who is scheduled for an ileostomy has an order for oral neomycin to be administered before surgery. The nurse understands that the rationale before administering oral neomycin before surgery is to? Ang sagot po natin dito is letter B, reduce number of intestinal bacteria. Okay? Neomycin sulfate is antibacterial. It is a drug of choice for colonic surgery because it is poorly absorbed in the GI tract and therefore it enhances excretion of intestinal bacteria. Okay, again, the rationale for administering oral neomycin before surgery is to reduce the number of intestinal bacteria. Sagot po, letter B. Number 15. The nurse should instruct the client with an ileostomy to report which of the following symptoms immediately. Again, the nurse should instruct the client with an ileostomy to report which of the following symptoms immediately. A. Passage of stool, liquid stool from stoma. Letter B. Occasional presence of undigested food in the effluent. Letter C. Absence of drainage from the ileostomy for 6 or more hours. And letter D. Temperature of 99.8 Fahrenheit or 37.7 degrees Celsius. Ang sagot po natin dito is letter C. Ileostomy normally expels watery stools continuously. Again, ileostomy normally expels watery stools continuously. And kung wala pong drainage for 6 hours or more, ibig sabihin there is obstruction. This needs to be reported immediately to the physician to prevent severe fluid electrolyte imbalances and infection. Basta ang sagot natin dito is letter C. Absence of drainage from the ileostomy for 6 or more hours. Abnormal na po yun. Okay? Number 16. The nurse evaluates the client's understanding of ileostomy care. Which of the following statements indicates that the discharge teaching has been effective? Letter A, I should be able to resume weightlifting in 2 weeks. Letter B, I can return to work in 2 weeks. Letter C, I will need to drink 3,000 ml of fluids a day. And letter D, I will need to avoid getting my stomach wet while bathing. The correct answer here is letter C. Ample fluid intake or adequate fluid intake is necessary for a patient with ileostomy to ensure adequate evacuation of stools. Okay? Resuming weightlifting and returning to work in 2 weeks is too soon. Masyado pong maaga. So mali po ang ating letter A and letter B. The stoma may be cleaned with water during bathing. So mali din po ang ating letter D. So ang ating sagot dito is letter C. I will need to drink 3,000 ml of fluid a day. Dapat madami-daming fluid po. Okay? For normal evacuation of stools. Next question, number 17. The nurse discovers the client's TPN solution was running at an incorrect rate and is now 2 hours behind the schedule. Which action is most appropriate for the nurse to take to correct the problem? Again, the nurse discovers the client's TPN solution was running at an incorrect rate and is now 2 hours behind schedule. Which action is most appropriate for the nurse to take to correct the problem? A. Readjust the solution to infuse the desired amount. Letter B. Continue the infusion at the desired amount. Letter C. Double the infusion rate for 2 hours. And letter D. Notify the physician. Our answer here is letter D. When TPN infusion is delayed, the nurse should notify the physician because the physician orders recalculation of the TPN. And the nurse should not attempt to catch up with the infusion without physician's order. Again, our answer here is to notify the physician. Letter D. Number 18. Which of the following should the nurse interpret as an indication of a complication after the first few days of TPN therapy? A. Glycosuria. B. A 1 to 2 pounds weight gain. Letter C. Decreased appetite. And letter D. Elevated temperature. The correct answer here is letter D. The most common complication of TPN is infection, as manifested by elevated temperature. The infection usually occurs at the TPN catheter insertion site. Okay? Glycosuria is initially expected because TPN solutions have high glucose content. Weight gain indicates effectiveness of TPN and also decreased appetite is expected kasi nga busog ang cells. Okay? So, an indication of a complication after a few days of TPN therapy is letter D, elevated temperature because it is a sign of infection. Number 19. Which of the following medications would the nurse anticipate administering to a client with diverticular disease? Ang sagot po natin dito is letter A, psyllium hydrophilic muciloid or metamucil. Metamucil is a bulk-forming laxative. It is the laxative of choice in diverticular disease because the primary cause of diverticular disease is low bulk of stool due to low fiber diet. Okay? Again, our answer here for the laxative of choice for diverticular disease is letter A, metamucil. Number 20. A client who had an appendectomy for a perforated appendix returns from surgery with a drain inserted in the incision site. The nurse understands that the purpose of the drain is to accomplish which of the following? A. Provide access for wound irrigation. B. Promote drainage of wound exudates. Letter C. Minimize development of scar tissue. And letter D. Decrease postoperative discomfort. Ang sagot po natin dito is letter B. Promote wound drainage of wound exudates. Wound drain, like Penrose drain, promotes drainage of wound exudates from perforated appendicitis. Okay? Again, our answer here is letter B, to promote drainage of wound exudates. Number 21. In a client with an acute appendicitis, the nurse should anticipate which of the following treatments? Again, in a client with acute appendicitis, the nurse should anticipate which of the following treatments? A. Administration of enemas to cleanse the bowel. B. Insertion of nasogastric tube. Letter C. Placement of a client on NPO status. And letter D. Administration of heat to the abdomen. Our answer here is letter C. Placement of client on NPO status. A client with appendicitis is placed on NPO status to observe pattern of abdominal pain more accurately and in preparation for surgery. Okay? Enema, laxative, and warm application over the abdomen should be avoided. Kasi this increase peristalsis and may cause rupture of appendicitis. Okay? Number 22. A client who has history of inguinal hernia is admitted to the hospital with complaints of a sudden, severe abdominal pain, vomiting, and abdominal distension. Based on this assessment findings, the nurse suspects that which of the following complications has developed. Ang sagot po natin dito is letter C. Strangulated hernia is characterized by sudden, severe abdominal pain, vomiting, and abdominal distension. This requires immediate herniorrhaphy. Again, ang sagot po natin dito is letter C. Strangulated hernia. Number 23. A client has just had an inguinal herniorrhaphy. Which of the following nursing interventions would be appropriate for his care? A. Help the client to turn cough and deep breath every 2 hours. Letter B, apply an ice bag to the scrotum. Letter C, apply a truss before the client ambulates. And letter D, maintain the client in high Fowler's position while in bed. The correct answer here is letter B. After inguinal herniorrhaphy, prevent ang edema of the scrotum by applying ice bag in the area and elevating the scrotum with rolled towel. Okay? Coughing is to be avoided post-op because it can weaken the repair. So, mali ang ating letter A. Truss is no longer indicated because hernia is already repaired. And high Fowler's position may cause edema of the scrotum. So, our answer here is letter B. Apply an ice bag to the scrotum. Okay. I think this is our last item and thank you po sa panonood. Maraming salamat po. I hope na meron po kayong natututunan sa ating mga videos. Maraming salamat po and adios.